Hello, YouTube. My name is Whintz. I'm an RN, BSN, MSN student through National American University. This is a video assignment for NS 6115, Lesson Plan 4. The assignment is a contemporary issue in health policy and nursing. The reason for this video today is to discuss a healthcare crisis. In order to talk about a true healthcare crisis, we need to talk about health disparity in the United States. First of all, we want to talk about the large disparity in overall health of inhabitants of the United States. Most of the health disparity is based on race, ethnicity, education, and even disability. Rising cost of healthcare can also affect the disparity of health within the United States as well. Also, improved access to healthcare insurance. However, with the passage of the Affordable Care Act, it has actually increased the cost of insurance for most people that consume healthcare insurance. Highest cost for healthcare, but we rank actually lowest on access, healthcare outcome, and healthcare-related mortality. We're 11th respectively in the world. So, kind of why we're talking about this, and we want to make sure that we have action, is we want to be able to improve both the healthcare access, but as well as we want to decrease mortality, morbidity, and we want to reduce the cost that is delivered to those who suffer from health disparity. Here's an example of how much we spend while even underperforming. So if you can imagine the higher performing United Kingdom versus the United States, you can see on the far right, we don't perform as well as other countries, even though we spend a lot more. And this next slide will actually show here. So on here, you can actually see the overall ranking as far as the level of care that's provided, as well as equity, healthcare outcomes, administrative efficiency, access to healthcare as well. So why do we spend all this money on healthcare, but we don't get anything for it, or we don't even see an improvement over any of the other countries within the world? So I want to talk about that a little bit. And again, what I want to talk about is the difference between cost. And cost is a big factor when it comes to both health disparity and people who seek out health care. Traditionally, most people, if the emergency room becomes an only option because, number one, they don't have health care insurance, and number two, they don't have the money to pay for the co-pays. So there's a lot of factors that kind of roll into that. So what I wanted to bring light to is the cost of emergency room visit versus an acute or an urgent care situation here. As you can see, most of the things that are really, really high, let's go to and look at the highest one on here is urinary tract infection, where it costs an average of $665 per emergency room visit. It only costs a fraction of that at $112 per urgent care cost. And you can see almost all of the other ones here, for example, are a fourth or a quarter of what it costs to go to an emergency room for. So that disparity alone means that there's some cost savings and some cost benefit for both the emergency room and the acute care. Again, I wanted to kind of draw light to this. So if you look at that, again, it shows you some of the things, the most common conditions that are seen in an emergency room that can be seen in an acute care situation. So I wanted to really bring light to this. For example, the strep throat. We talked about the urinary tract infection, but most of these things are common things that can be cared for in an acute care setting or an urgent care setting versus going to an emergency room and paying triple the cost. So what do I propose? I want to propose to lawmakers to provide federal funding for an acute care, not just acute care in a clinical setting, but I want to embed primary care physicians within emergency room departments. Why does that work? So it reduces fallout because you have that continued follow-up with your primary care provider. You reduce the cost of non-emergent visits. What does that mean? All those costs that triple the cost of an emergency room visit can be reduced into a 1/4 of that cost for an urgent or acute care situation versus emergency. Establish triage nurses to route to appropriate areas. So what does that mean? We all see triage nurses standing outside of an ER asking people what they're here for. And as I was an emergency room nurse as well, so I did the same thing. But we can meet those patients' needs and not charge them triple, for the experience. So that's one of the reasons why I wanted to talk about embedding in acute care or primary care within the emergency room. increase hours of acute care, possibly a 24-hour care provider, or within the ED. So they would share emergency room assets, but still have the ability to see those non-emergent but more acute patients. Also wanted to point out here, 13 to 27 of emergency room visits in the United States can be treated non-emergent areas, which has a potential savings. Like I said, cost benefit, health disparity. People don't go see healthcare, don't receive healthcare because they don't have the money or they don't have the health insurance. So if we can save $4.4 billion in an annual basis, reduce the cost, increase our outcomes, reduce mortality and morbidity, it's worth looking at. It's worth funding, and I think from a government standpoint, I think we can make a big difference and a big impact in this. So I want to thank you again for your time in reviewing this information. I hope it has brought light to some of the health disparities amongst the United States and the population of those that are afflicted by this. And again, I want you guys to know that we can all save money by providing better health care to those who truly need it. And I think that overall is why we do the things we do. That's the reason why I became a nurse, is to help people. So as you can see here, these are my list of references that I used for this video. If you have any other questions, please put your comments in the video and I will respond to them. But again, thank you. My name is whintz. I'm a RN BSN MSN student for National American University. Thank you for your time.